work sessions. A, Fire and Emergency Medical Services Annual Update. Chief Senter.
Good afternoon, Mr. Chairman, members of the board, Dr. Casey. Thank you for the opportunity to come before you today and present the annual update for the Fire and EMS Department. In the time that I have this afternoon, I'll be highlighting the activities, accomplishments, and challenges of the Emergency Operations Branch, which is the largest and most visible segment of our department. However, I'd be remiss if I didn't recognize the uniformed and civilian members of the Community Risk Reduction and Management Services branches. These individuals work hard every day, often behind the scenes, to prevent fires and enforce the fire code, to help residents prepare for and recover from disasters, and ensure that our firefighters serving on the front line have the resources they need to be successful. I must begin on a somber note yet again this year in paying tribute to Captain Robert Talbot, who passed away on December 20th after a short but valiant battle with an aggressive form of occupational cancer. Lieutenant Talbot was a beloved member of our department, and his passing marked the loss of the fourth active duty firefighter and third line of duty death in just 3 years' time. I couldn't be prouder of how our members came together and leaned on one another and supported the Talbot family in their time of need, while continuing to support the Eldridge, Monahan, and Ware families, who will also forever be part of the Chesterfield Fire and EMS family. As our members know all too well, despite their collective grief upon losing a colleague, the show must go on. Throughout the last fiscal year, our members reported for duty and handled over 55,000 incidents, another record for the department. While approximately 3% of these incidents can be explained by improved documentation of patient contacts by our Mobile Integrated Health, or MIH team, fire and EMS incident growth directly attributed to the 911 system has increased at over 2 times the rate of population growth in the county over the past 5 years. While there were steady increases in all 3 categories of incidents, 76% were EMS related, and over 33,500 patients were transported by our career and volunteer members to area hospitals. Among those statistics, there are several observations worth noting. First, over 67% of patients transported last year were 65 years of age or older. This fastest growing demographic will place persistent pressures on our EMS system for years to come and will be a common theme throughout my presentation today. Second, a larger percentage of our services involve basic level medical care, which suggests further refinement in our system to provide a more appropriate level of care for many of our patients. A few years ago, Matt Harris worked with us to apply ARPA funding in support of 12 firefighter positions to activate a new peak demand ambulance program and shore up our long-standing MIH program. The Peak Demand Ambulance Program is focused on meeting the needs of low acuity patients during times when service demands are highest. This successful program has helped reduce the workload on our busiest 24-hour career ambulances, with many of those that are staffed with firefighter paramedics, and keeps those units available for more serious cases. Our MIH program also continues to be highly successful in addressing the needs of patients who are chronically ill or suffering from mental illness or substance abuse, and who would otherwise be high-end users of our 911 system. This fiscal year, the 12 previously grant-funded positions have been transferred into the general fund, and both innovative programs are positioned well for future growth to better address unique patient needs. In partnership with the Nova Blood Services, we continue to experience success with our whole blood program in providing life-saving treatment to our most severely injured patients. We are moving forward with plans to add whole blood to the battalion chief unit that serves the west side of the county to shorten deployment times there. We are also actively working with other localities in the region who are interested in standing up their own programs. Last fiscal year, the Fire and EMS Department responded to 311 structure fire-related incidents, an average trend over recent years. 24 of those incidents resulted in $100,000 or more in losses, representing a collective property loss of nearly $10 million. The leading cause of structure fires continued to be cooking-related, and as expected, the most likely area of origin was in the kitchen. Sadly, 2 civilians lost their lives from fire-related causes, one involving a space heater and another one due to smoking while on home oxygen. Another 33 citizens were injured. FY 2025 represented a below-average year for fire deaths and a slightly below-average year for fire-related injuries as compared to previous years. Last fiscal year, all fire and EMS response districts experienced increases in incident volume, averaging 7.8% per district. This was much higher than the previous year's average of 2.5% per district. The top 3 busiest response districts in the county remain consistent among the Beaufort, Chester, and Dale fire and EMS stations. The top 3 911 calls last year included nonspecific illnesses, falls, and fire alarm activations. Further indicative of pressures on from an aging population, 1,681 lift assists were among the top 10 911 calls for service last year. For the first time in decades, we have adjusted the borders of the urban zone by better defining the parameters of the service area where population density and service demands are generally higher and are therefore more in need of responsive and comprehensive services. The urban zone is now defined as those areas of the county where there are 250 or more address points per square mile to include contiguous areas. And it's important to note that our definition of the urban zone certainly does not match the federal definition. Nonetheless, it serves as an effective way of defining different levels of service areas within the county. The urban zone in Chesterfield has been expanded to incorporate areas on the west side of the county from Westchester Commons to the south through the Halsey, Roundtray, Summer Lake, Westerly, Magnolia Green, and Harper's Mill neighborhoods. The expansion of the urban zone also includes the Highlands, Woodland Pond, First Branch, and Lake Margaret. Again, this is a definition just for the fire and EMS department and helps us organize and deliver our services to the community. The majority of the top 10 locations for incidents last fiscal year included nursing homes. In fact, among the top 50 locations generating 911 calls last year, 28 were nursing homes, assisted living, or independent living facilities. A closer look at our top 10 locations shows that nursing homes on that list generated 2 calls per bid on average last year. While it's true that nursing homes can be expected to generate higher call volume individually, collectively they help reduce EMS calls countywide through the direct care and assistance provided to chronically ill or disabled seniors. And if you think about it, just one of those nursing home patients could easily generate 10 times or more the number of EMS calls if they were trying to age in place in their home. And in fact, a common intervention by our MIH team is to work with the families of senior residents who are high-end 911 users to place their loved ones in a long-term care facility that can better manage their needs and provide an improved quality of life. The challenge, however, we as an EMS agency often face is that many of these facilities are concentrated in areas of the county where incident volume is already high. And I'll draw your attention to the top of the map where you see, for example, the highest concentration of nursing homes and memory care facilities in the county are along the Midlothian Turnpike corridor, where 15 facilities collectively generated over 2,600 calls for service last year. As our population ages, more nursing homes, assisted living, and independent living facilities will indeed be needed. I simply ask that we keep in mind this need and plan for additional EMS resources to serve these facilities in the future. A critical element in a high-performing EMS system is prompt access to hospitals with an array of services needed by the community it serves. Unfortunately, as you know, there are only 2 full-service hospitals currently in Chesterfield County. The Fire and EMS Department believes strongly in honoring patient choice, and because of limited options within the county, approximately 46% of our patients were transported to facilities outside Chesterfield County last year. Now, the effectively placed freestanding emergency departments do help fill the gap in the continuum of care, as demonstrated by the Chester freestanding emergency center, which continues to be the busiest freestanding ED in the entire Bon Secours Mercy Health System. And we're very excited that the construction has started just across the street on HCA's new freestanding ED near the County Government Center, which is expected to open sometime late next summer. I know Mr. Carroll, Dr. Casey, and I will be speaking tomorrow at a Virginia Department of Health public hearing to support 3 more exciting proposals for the county. One by VCU Health System to build a new 60-plus bed hospital along the new Nash Road extension. One by HCA to build a new 60-plus bed hospital along Route 360 at Otterdale Road. And one by Bon Secours to expand the number of beds at St. Francis Medical Center. If approved, these facilities will greatly improve Chesterfield residents' access to health care and help increase the efficiency and effectiveness of our EMS system. Our highly trained members, as we discussed earlier, stand ready to help other localities at a moment's notice in their time of need. Chesterfield County is a signatory on both the Central Virginia and the statewide mutual aid agreements, and the Fire and EMS Department regularly participates in automatic aid with our bordering localities. Under MOUs that we've established with the Virginia Department of Emergency Management, the department's Urban Search and Rescue Team, and the HART Team, and the Region's Incident Management Team, which is also sponsored by Chesterfield Fire and EMS, are assets that can be deployed across the Commonwealth and throughout the continental U.S. when requested. It was a very busy season for these teams last year, with 11 individual natural disaster deployments that at times resulted in all three teams being deployed on the same event. The most significant event was in late September, with severe flooding in Southwest Virginia caused by the remnants of Hurricane Helene. During the deployment, the HART team utilized helicopter hoists under difficult flying conditions to rescue 6 different victims trapped in fast-moving floodwaters. Similarly, the USAR team rescued 8 individuals and assisted in the safe evacuation of 8 others, performed welfare checks on 90 residents who were cut off by flooding, and performed searches and damage assessments on 167 different structures. With significant uncertainty about the future of FEMA, there is a growing concern that the burden of providing specialized expertise and equipment and coordination assistance during disasters will inevitably be shifted to the states. Statewide deployments and even state-to-state mutual aid requests for our specialty teams are expected to increase in the future. One of the most successful state and local partnerships is the MedFlight program. Over 40 years ago, the Virginia State Police and the then Chesterfield Fire Department joined forces in forming the MedFlight program. Today, the helicopter is staffed around the clock by a Virginia State Police pilot and 2 Chesterfield firefighter paramedics. The program handles over 600 missions annually, mostly for air medical services in many of the rural communities to our south and west. This year, the program experienced an increase in mission requests along the Blue Ridge Mountains for hoist rescues of injured hikers. You may recall the costs for Chesterfield staff assigned to the program are now covered entirely by the Commonwealth of Virginia. Despite the increased incident activity last year, we found time to recognize the accomplishments of those who assumed new duties and responsibilities as leaders in the department. In total, 13 uniformed members were promoted after years of experience and preparation and success in highly competitive processes. We also took time to bestow 113 awards to multiple individuals from public safety agencies and the community at large for going above and beyond in service to others. This included 19 individual Life Save Awards and 55 Unit Life Save Awards. Worthy of special recognition were the actions of 8 Virginia National Guard pilots and flight crew and 6 Chesterfield firefighters and fire officers during Hurricane Helene. These members were awarded the department's Medal of Valor, which accounted for the highest number of such awards in a single year. The Virginia National Guard also bestowed one of their highest awards on these same team members, and Brigadier General Todd Hubbard and Lieutenant Colonel Matt Lewis were on hand in March to present each member with the Virginia National Guard's Bronze Star, another history-making event. At the regional level, Captain Bryce Ford and firefighter Greg Potter were among those honored at Valor RVA's annual awards ceremony in December, and I know many of you were present. Each were recognized for their efforts in saving the lives of multiple victims at a 2-alarm fire at the Waterford Apartments. Amanda Danahay, EMS Continuing Education Coordinator, received the Outstanding Pre-Hospital Educator Award from the Old Dominion EMS Alliance. She will automatically be considered for the same award this year under the Governor's EMS Awards program. And Captain Jerry Pruden received the Fred Parker Award from VCU's Center for Trauma and Critical Care Education. Members of the Fire and EMS Department were also among those recognized under the Governor's Fire Service Awards program last year. Battalion Chief Rick Grassel was recognized alongside other members of a work group that developed the Commonwealth's electric vehicle firefighting program. And this firefighting program is now mandatory for all firefighters in Virginia, both career and volunteer. Members of our MedFlight team were recognized for rescuing an injured hiker in Augusta County. In a separate action, Colonel Hanley of the Virginia State Police bestowed a Superintendent's Award upon the MedFlight team for other hoist rescues last year. Another achievement worth celebrating is the improvement over recent years in the department's relief factor for covering daily minimum staffing needs in emergency operations. With this board's strong support, we've been able to add 48 new positions and allocate 164 positions to each of the 3 emergency operation shifts, which equates to a 1.32 positions per minimum staff position per shift. It gives us enough overhead to be able to cover those daily needs. As you can see from the charts on this slide, this investment has significantly reduced both the number of mandatory overtime occurrences and actual overtime costs. Improvements have even continued into the current fiscal year with less than 1 mandatory overtime occurrence per day on average. This effort has enhanced the work-life balance for our firefighters and greatly improved morale, and thank you for the support for that. Achieving a 1.32 relief factor was nearly a 10-year journey, and the formula was based on data that in some cases is now 9 years old. As Dr. Casey has mentioned previously, a 1.32 relief factor may not be sufficient for the future, considering parental bonding leave and other flexible leave benefits that are now available to our members. We're also experiencing increased pressures in covering service gaps among our volunteer rescue squads and meeting EMS standby expectations at special events. And I'll talk a little bit more about those later in our presentation. But collectively, these things risk some of the gains that we've made in reducing overtime and also reducing the number of mandatories. Various facility improvements were accomplished last fiscal year, including the installation of diesel exhaust extraction systems in most fire stations that was funded largely by a Federal Assistance to Firefighters grant. The new Matoaka Fire and EMS Station completed its first full year of operation, and the new Chester Fire and EMS Station was designed and is currently out for bid. Other initiatives included the design of the new Ettrick Fire and EMS Station, which is in final review, and the stand-up of a new in-house, state-mandated pharmaceutical supply chain for our EMS system in partnership with Buford Road Pharmacy. Finally, there were numerous security enhancements at multiple fire stations, which ended up being a timely investment following a rash of larcenies involving firefighters' vehicles at fire stations throughout Central Virginia last year. Last September, we formed a team that began leading the fire department's efforts to achieve agency accreditation by the Center for Public Safety Excellence, also known as CPSE. Through the hard work of our accreditation team and involvement of all of our divisions, the department achieved applicant status in July and will be considered for accredited status during hearings in August by the Commission on Fire Accreditation International. If we are successful, as I believe we will be, the board will then be able to proudly say that all 4 public safety agencies in the county are accredited. We're looking forward to that day. CPSE accreditation is then valid for 5 years with annual compliance reports required each year. The benefits of accreditation are wide-ranging. First, it promotes a culture of continuous improvement, focusing on identifying strengths and weaknesses and establishing plans for improvement. Second, accreditation better facilitates data-supported decision-making and benchmarking with like agencies. Finally, an outside third party will regularly review and validate our department's programs and performance in congruence with best practices. While there was much accomplished, there were indeed challenges during FY 2025. As you know, Chesterfield County has a long, proud history of volunteerism. In the late 1960s, 12 volunteer fire companies and 4 volunteer rescue squads provided all firefighting and medical services in the county, many of which were very rudimentary at the time. Over a period of decades, the combined effects of ever-increasing service demands, advanced training requirements, and risks to safety and health have prompted a decline in the number of volunteer first responders in the county, and that's not unlike other experiences in other communities our size. Today, only 5 volunteer organizations remain capable of providing emergency services, including 4 rescue squads with a combined 128 certified EMS responders and 1 fire company with only 12 certified firefighters. Of particular concern over the past 5 years is the sharp decline in coverage by 3 of our volunteer rescue squads and a marginal decline by a 4th. In many cases, shortages among our EMS crews occurred at varied times and days, often with little to no advance notice, leaving key response districts void of ambulance crews. This was most impactful on weekends and holidays when there were 66 days when 2 key EMS districts were unstaffed and 35 days where 3 key EMS districts were unstaffed last year. At the same time, there were up to 5 fewer career ambulances on duty, and on some days there were thousands of visitors attending the county. Similarly, because our rescue squads are transporting fewer patients, they are also, in many cases, experiencing unsustainable reductions in EMS billing revenue, increasing the risk for insolvency in future years. There are 2 frequent coverage gaps in the county's EMS system that are of most concern. The first is the EMS district assigned to the Manchester Volunteer Rescue Squad on weeknights and weekends, the center of which is at the intersection of Courthouse and Hull Street Roads in the Clover Hill District. This district is covered during weekdays by firefighters frequently working overtime. Despite an increase in the fire and EMS department's practice of assigning available staff to cover this area when Manchester Volunteer Rescue Squad was unable, the EMS district was void or left without immediate ambulance coverage 20% of the time last year. And when this district is voided, it directly affects the reliability of surrounding ambulances as the next closest unit moves in to cover calls in that district. It also increases the number of EMS calls where heavy, very costly fire apparatus are dispatched as the closest available resource. The most significant impact was on the ambulance at the Swift Creek Fire Station on Genito Road, which was the 7th busiest ambulance in the county last year. Similarly, the ambulances at the Manchester and North Courthouse fire stations, among the busiest ambulances in the system, were also heavily impacted by calls in Manchester's primary service area. The map on this slide shows the impact on ambulances in adjacent areas, some of which also cover areas in the Midlothian, Dale, and Matoaca districts. What this map doesn't capture are the indirect cascading impacts that often occur in the EMS system that can at times reach deep into the Bermuda district. The second area that is of concern is the EMS district on the eastern end of Midlothian Turnpike in the Midlothian district. This area is covered weeknights and weekends by the Forest View Volunteer Rescue Squad and during weekdays by firefighters frequently working overtime. While Forest View remains our strongest volunteer rescue squad and has been successful in improving their staffing coverage in the current fiscal year, they continue to be pressured by high call volume in serving the busiest EMS district in the county. Over 3,700 EMS incidents occurred last year in this district, representing a nearly 30% increase over the past 5 years. Over the long term, we cannot expect volunteers, many of whom have career and family obligations, to carry the brunt of this workload that will only increase with more high-density development and senior care facilities coming online in this area of the county in future years. Even when there is a staffed volunteer or career ambulance covering this area of the county, there are often concurrent calls that occur and must be handled by the next closest ambulance. 2 of the adjacent career units that are impacted the most include the ambulances at the Manchester and North Courthouse Road fire stations. Essentially, 2 adjacent EMS districts last year added a combined 1,440 calls to the volume handled by 2 of the busiest ambulances in the system. Looking ahead, we know that most of the volunteer rescue squads are seeking lower yet more achievable staffing goals in our MOU updates this year. Unfortunately, this change is expected to leave some coverage gaps in the short term that may be filled by firefighters working overtime and even mandatory overtime if necessary. But simply put, we cannot let the system fail. Chesterfield is fast becoming a signature destination for sporting and other special events, bringing in thousands of new visitors each year, and this is very exciting and good for the county. As crowd sizes increase, so does the need for EMS standby coverage. For decades, we've relied on our volunteer rescue squads to provide that coverage, but coupled with increases in these types of events and size and complexity, coupled with the decline in volunteer participation overall, many of the volunteer rescue squads are no longer able to meet this demand. Those squads that do regularly cover special events are then unable to cover their commitment to the 911 system most of the time. The fire and EMS department has also struggled in providing consistent EMS standby coverage without degrading 911 service to the residents. As a stopgap measure, EMS standbys at large county-sponsored events are covered with firefighters on unplanned overtime. Other large sporting events at River City, for example, have been referred to private EMS agencies for standby services when needed. To be clear, not all special events require EMS services, and many organizers who request such standbys are just simply trying to assure a risk-averse event. Our research suggests that except for extreme sporting events or in cases where participants or spectators are at increased risk of medical emergencies, such as large groups of elderly or those with special needs, EMS services are a reasonable consideration only when an incident or an event exceeds 2,500 spectators. Recently, we've begun working with Matt Harris to consider a proposal to employ part-time EMS-only positions to expand our peak ambulance coverage and to provide more consistent EMS standbys at sporting and special events. And it's my understanding that that proposal will be working its way to you very soon. To that end, I welcome the opportunity to discuss the proposal in detail and answer any questions that you may have, and look forward to some important policy discussions with the board in the future on the topic of EMS standbys for sporting and special events. Over the past 5 years, a crisis has emerged that is impacting fire departments nationwide, resulting from significant price increases in fire apparatus and extended delays in the production and delivery processes. Fire apparatus manufacturing is a highly specialized industry. Fire apparatus is often custom built to protect the risks present in the community to be served and to accommodate anticipated changes in service demands over the service life of the vehicle. Throughout the late 1990s and early 2000s, there was contraction in an already small apparatus industry, and in some cases, equity firms acquired and consolidated multiple small manufacturers. The Great Recession prompted deferrals in municipal apparatus purchases, and then came COVID with associated supply chain and labor shortages. With the influx of federal ARPA funds, many municipalities were able to catch up on purchases, and record numbers of orders were placed in a very short period of time. Since that time, the industry has struggled to increase manufacturing capacity quickly and is beset by ongoing labor shortages, rising material costs, and expensive impacts of regulatory changes. Despite many changes in our apparatus specifications to keep price increases as low as possible, we no longer have sufficient funds in our apparatus replacement program to consistently purchase enough units per year to turn over the fleet at recommended intervals. And I know this problem exists throughout the county and other fleets. This issue is further compounded by the fact that we have multiple new apparatus on back order, as you see on the screen, which causes us to keep older apparatus in service longer and experience more downtime and repairs. We appreciate Matt Harris and the Budget Department working with us last year to provide a one-time funding increase, but we know a long-term strategy for more sustainable funding in the future is needed, and I know the fleet manager is working on an entire wholesale assessment countywide. Chesterfield County continues to experience robust growth, adding more population over the past 5 years than any other single locality in Virginia. With that growth comes thousands of units of single and multifamily dwellings, high-density mixed-use developments, and very large, complex commercial buildings that present new and unique challenges for our firefighters. In recent years, we conducted training, we implemented new strategies, and introduced new equipment to better meet these challenges. As we've gained experience fighting actual fires in this new environment, we have quickly recognized that our fire company staffing levels that may have been suitable for a traditional suburban area are no longer adequate for our new normal. As you know, last year we tried unsuccessfully to pursue a federal Staffing for Adequate Fire and Emergency Response, or SAFER grant, to increase minimum staffing to 4 firefighters on 4 key engine companies. We chose not to apply again in the most recent cycle because the reasonable ask that we would have, somewhere between 16 to 20 firefighters, is insufficient to achieve the necessary service improvement scores to be given final consideration for the grant in accordance with the Notice of Funding Opportunity. There have also been some major structural changes in the grant program that would increase the local match early on in the grant period. While I'm not ruling out future grant opportunities, the reality is that we may need the board's support in the future to consider other options to begin making incremental improvements in our company staffing levels over the long term. Last year, we continued to make progress in addressing the 57 recommendations included in the ESCI report, with close to 50% completed and another quarter in progress. It's important to note that much of the analysis included in the ESCI report has been updated and absorbed into the department's new community risk assessment and standards of cover document that you've been presented with previously. And this document is required for accreditation and will function as a living document going forward that is updated annually. Some recommendations within the staffing and deployment section of the ESCI report, such as the relief factor and support staffing needs, will remain as standalone items, the basis for which will also be reviewed and updated annually. And then, Dr. Miller, I know last year after I gave the update on the ESCI report, I know you asked a good question of, what are some of the other end of the spectrum ideas or issues that need to be addressed to provide support for the department that the board needs to be aware of. And this year, I can certainly point to a comprehensive document in the department's 5-year strategic plan that will serve as a roadmap for continuous improvement and will influence our additional funding requests in future years. Accordingly, the board may be interested in knowing some of our priorities that are located in this document. First, under service improvements that will be necessary, we will be asking the board to consider programming into the 5-year financial plan for an additional 3 24-hour career ambulances to counter the effects of declining volunteerism while at the same time keeping up with anticipated increases in EMS volume. In the short term, we'll be asking for your support in kicking off EMS-only positions on a part-time basis to increase our peak demand ambulance coverage and better meet EMS standby needs. If this program is successful, we may then seek approval at some point to convert some of these positions to full-time staff and serve in a similar role to the police service aid program that's been very successful from a recruitment perspective. For a longer-term perspective, we will continue to pursue options to incrementally increase the minimum staffing levels on our engine companies to 4 firefighters each to better protect emerging risks in our community. Second, under capital needs, we'll be asking the board to consider increasing the funding level in our apparatus replacement program and to consider adding the new Highlands Fire and EMS station to a future CIP budget. We estimate that the Highlands station would bring in over 2,000 address points from a current ISO public protection classification rating of a Class 10W to a Class 2, which could mean real savings for many residents' insurance premiums. In terms of recruiting and maintaining a high-performing workforce, we appreciate the board's efforts to in terms of recruiting and maintaining a high-performance workforce, we appreciate the board's efforts to maintain market competitiveness in our pay plans and other compensation and benefits. Finally, at the end of the current fiscal year, we will work with the Human Resources and Budget departments to reevaluate our relief factor and consider improvements to relieve staffing pressures when necessary. Mr. Chairman, that concludes my presentation, and I'll be happy to answer any questions that you or the board may have.
Board members, any questions or comments?
I didn't see the 8 for 24 in here. Is that included in that large number of 20 years that you were asking for?
So there'll be 3 units. So the one at the Manchester Volunteer Rescue Squad, that would be our top priority, and we could stagger these over the 5-year period. I really think we need to start planning for these. The activity is going to continue at the Buford Station, and then eventually when we replace the Ettrick Fire Station, we may be in a position where we'll need to add an ambulance there.
Yeah. When I went out the other day on the ride-along, it's just, when you think about how large of a station or a district they have at 9 and how much they have right there and how far in, they go to the city line basically and out towards Tarrington, and that's just a huge kind of.
Geographically, it's not a very large district, but it's very densely populated, and it generates a lot of calls.
Yeah.
And then we have, with the Spring Line at 60 development that's going up, we'll have, eventually a 12-story hotel and convention center there that may generate some calls. But that is a very rapidly growing area for sure.
Okay. All right. Thank you.
Well, thank you.
Mr. Chair. Thank you for a great presentation, Chief. I think it's important for the community to understand how, as we grow as a community, how we have to provide the resources for it. And I don't see it stopping anytime soon, based on some of the projections of residential development that's already available, that's been approved years ago, and some by this board to come out of the ground. So I appreciate your department. You do a great job in staying on top of all this, and I enjoyed the ride-along that I did the other day with the crews. It's great to get out and talk with the firefighters and hear things from their perspective. So
Well, thank you all for coming out when you
Yep.
can. We know you have a busy schedule, but the firefighters really enjoy seeing you and showing you the good work that they do. Thank you.
Well, thank you, Chief, and you anticipated my question. I already had it written down, so well done. The volunteers.
Yes.
My wife and I have attended the last 3 evenings, dinners they have at the end of the year.
Yes.
And what we have found, that we end up talking about it for hours afterward, is just the community.
Yes.
And how much they love each other, how long they've been doing it together. And so I just want to put out to the community, if you're looking for a way to volunteer and a way to give back and a way to just be part of something incredibly special with some very good people, this is a way to do it. I think with Forest View specifically, I see the strength in the room every year. So
Absolutely.
I just want to put out some appreciation and kudos that direction.
And the citizens should know you don't have to be expected to run calls. There are administrative volunteers
That's right.
and things that they do to help the community as well.
That's right. And just as appreciated and just as honored and
Yes.
all the rest. Yeah.
And to be clear, we love our volunteers and we want to make them successful. We understand that they are less likely to be able to cover the duties that we have asked them to cover in the past. And so we're going to situate them so that they can be successful whatever time they can commit. And we've got some ways to do that to make sure that they get access to calls and certainly can help the community in the way that they have. Go ahead.
Chief, thanks for a great presentation. Thanks for referencing the Highland Station. I know they will really appreciate the relief that you will provide for them in the coming years. So thank you for keeping that on the radar.
Thank you.
Well, a lot has been said already, but one thing I don't think we've focused on a lot yet is the EMS-only positions and how you can use that, like the police department has with the PSA program. And I know I'd asked you to look into figure out how you could make a program like that work. And with 76% of our calls being EMS calls, that's absolutely a good way to go. So I applaud you for working on that program and putting
And
it
it gets
together.
especially some of our younger adults that may not have the work experience or they may not have college and don't gain the points in the hiring process that others would. This gives them an opportunity to develop that work experience. We get a good look at them and, can offer them a spot in an upcoming recruit school.
Good job. Thank you.
Thank you.